Hello and welcome everyone. You're listening to the SCORPodcast, a show for IFMSA Pakistan and MSI India, where we dive into COVID-19 in human rights. I'm your host, Mahamikram, VP of IFMSA Pakistan, Vice President Activities. In this podcast, of episode 3, you'll hear human rights enthusiasts discuss how the COVID 19 pandemic has impacted fundamental human rights all over the world and the things they have learned along the way. In today's episode on mental health, emergencies, disasters, and humanitarian action, our guests are Ritika Mishra, along with Maha Rahman and Alamtaib Khan. We also have Mr. Hassan Moin on board with us today, the founder and CEO of My Restful Mind, web-based mental health service provider started by the students for the students in Canada. Let's begin with a brief round of introduction. Welcome everyone. Thank you for joining us today. Mr. Hassan, please introduce yourself and your organization for our listeners.
Hi everyone, my name is Hassan Moin and I'm the founder and CEO of My Restful Mind. I am also a fourth year university student at the University of Waterloo and I've been working with student mental health since the last 2 years.
Would you like to tell us something about your organization?
My Restful Mind is a platform that connects students and young adults to therapists online. We also provide them with virtual mental health care resources such as a self care kit and peer support mentorship. In times of quarantine, it is a huge privilege that you can talk to someone from the comfort of your home. So do check out my Restful Minds website. It is globally accessible, and now we are planning to expand our operations in Pakistan.
All right. Thank you so much. It was a delight to have you, Mohsen.
Same here. Pleasure meeting you all.
We'll move on to our next speaker. Hi, Ritika. Please introduce yourself.
Hello everyone, I'm Ritika Mishra and I'm from MSCI India. I'm the program coordinator for mental health for IFMSA for this term and also the vice president for activities for MSCI India.
Next, we have Maha Rahman. Hello, Maha.
Hi everyone, I'm Maha Rahman. I'm a general member of IFMSA Pakistan, a senior year medical student. Earlier, I was regional assistant for SCORP, Standing Committee of Human Rights and Peace, for 2 consecutive years. I was also the liaison between IFMSA International and CRIMIDIM. I'm currently working with UNMGCY and IPPNW for the good work that you always see around. So yeah, that's my humble introduction for you. Thank you.
How is the quarantine treating you, Maha?
So the quarantine for me has been really productive. I've had a chance, beside my studies, to work on my goals, to work on IFMS and human rights things. Besides that, I'm also working with a couple of NGOs, stating UNMGCY and IPNW. So yeah, in this quarantine, for me, it's been really progressive. And then I also got time to spend with my family in the kitchen and all. So it's been good so far.
That's really wonderful, Maha. You're always up to something.
Thank you.
And would you like to tell us something else?
So for this podcast, it was a really nice point for me to come and talk to people about what's happening around and how disaster medicine is very important. I would, of course, talk more in detail later on. But for now, I would like to say that if this quarantine has been beneficial at any sort for the participants, for the listeners, so that would be a really good achievement. And I really appreciate the initiative that the coordinators have took.
Thank you so much, Maha. We really appreciate you coming in.
You're welcome.
And last but not the least, Alamtaib. How are you?
Hey, Mom, I'm good. So my name is Alamtaib Khan. I'm the regional assistant for KPK to the NORP for IFMSA Pakistan. I've been good. I'm back home in New Jersey. Cases have declined, and I'm just back to working for our business from being in SWAT for 3.5 months and working on the response team. Around when I was leaving, we already had a decline in cases, and now we have only 20 patients in our high dependency unit. So things are going better, right? We're handling the situation as good as we can, and cases have significantly dropped. And yeah, I've just been studying for my exams, working, trying to make that cash, and hiking, skateboarding, the hobbies and stuff. But thank you guys for inviting me again. I'm glad to be back and speaking on more disaster medicine, things I'm passionate about. So I appreciate the opportunity.
All right. Thank you, Alimsir.
Thank
Very
you.
delighted to have you too. Thank you so much, everyone. As we begin our discussion for today, I would like to highlight the fact that the COVID 19 pandemic and resulting economic decline have negatively affected many people's mental health and created new barriers for people already suffering from mental disorder and substance use disorder. As the coronavirus continues to spread at a time when climate change has increased the destructive potential of a host of natural disasters, this scenario could become a frightening reality. Coming on to that point, I would like to specially start this podcast and have input from our speaker, Mr. Hassan, and would initiate this discussion and have his input. Mr. Hassan, do you think the COVID 19 pandemic has had an impact on the mental health of individuals around the world? And if yes, how?
Thank you, Maham. Yes, I believe that the pandemic has had an impact on people's mental health globally. Since the time that the novel coronavirus has hit the world, mental health has taken a backseat to physical health, and hospitals, mental health professionals, and the governments have tried to stress upon keeping people safe at home and keeping the hospitals like burden sharing and like, less than so they shouldn't be overwhelmed. Schools, offices, and restaurants have been shutting down, and people have been forced to stay home, which have also kept them away from their family and friends, which definitely has an impact on the mental health. Story after story highlighting the ever increasing number of cases of of coronavirus, while also having a rise to the unemployment not seen since the Great Depression. Any one of these shifts can be expected to cause an increase in mental health issues. Put together, they create a perfect storm of crisis. Experts speculated as much. Polls show that many people seemed to automatically cross the mental toll, the pandemic. However, data on mental health metrics has scanned. We didn't really know the magnitude or any changes to mental health issues, nor did we understand who is suffering the most amongst the affected groups. Here, I would also like to add some statistics from US. 2,032 US adults was surveyed using a standard metrics of mental distress that asks, for example, how often a respondent felt sad or nervous in the last 1 month. The responses were compared with a sample of 19,330 demographically similar people to a 2018 government sponsored survey. The results were staggering, and 2020 participants were 8 times more likely to screen positive on mental illnesses in comparison to the 2018 results, which were 3.4%. These things clearly indicate that the pandemic has had a devastating effect on our mental health and needs attention.
Truly, Mr. Hassan, I definitely agree with you. What's your take on this, Ritika? Do you think the pandemic has taken a toll on people's mental health? Are there going to be any long term mental health effects?
Okay, thank you for your question. That was really thoughtful. So, my thought about this is that as the coronavirus pandemic drags on, there are many citizens that have dealt with their lives turning upside down. It's not just the lower economic or middle economic or highly economic population that's affected, but it's just affected everyone. Healthcare professionals are working long hours in tense conditions, putting themselves at risk of contracting the virus. There are some families that have lost multiple loved ones due to the disease, and others have also lost their jobs. Putting light on each one of the situations, first I'll talk about healthcare professionals. So, healthcare workers run a high risk of contracting COVID 19, and as a result, they may be at an even higher risk of developing severe depression than general population. This depression comes with a lot of stigma that is associated with COVID 19 and a lot of apprehension, and also the inability to meet your loved ones. And healthcare workers are facing a lot of them. According to the data of 2013 to 16, like during the Ebola pandemic, and the SARS pandemic of 2003, those who were quarantined are at a very high risk of developing mental disorders like depression. And the people who are at a maximum chance of getting quarantined are healthcare workers, because for them getting quarantined doesn't mean only when they test positive, but also when they're exposed, and that's happening a lot of times during their duties. The other thing is that people who have contracted coronavirus are at a heightened risk for depression or even PTSD. And so are those who's lost families or friends to COVID-19. The stigma associated with contracting the virus can also cause stress, shame, and avoidance among healthcare workers. And a number of healthcare workers might leave the industry because of anxiety. So now I see this as situation to be as healthcare workers. There are very less healthcare workers in most of the countries that we know. And why is this happening? This is happening because of apprehension. That is the stigma that is associated with COVID-19. No one wants to get quarantined. No one wants to not stay with their family. That's one. The second thing is, the amount of exposure that the healthcare workers are exposed to, that can cause them stress, and that can also cause PTSD and anxiety. I see the other thing as if this situation gets continued and dragged on, it will severely cause burnout and anxiety in healthcare workers, also PTSD, thus leading to even less healthcare workers available for us. Also, many people are opting to alcohol as a solution. Alcohol as a solution being either to get over their stress, either to get over the anxiety, or alcohol as a solution because there is nothing to do. Because of the lockdown and the pandemic, the people are spending most of their time at home, and some people are not obviously staying with their family, and they think how to pass the time, so they go for alcohol. But also the people who are already suffering from alcohol and drug abuse, for them it's like a gala time because there's nothing to do, there is no one to look, and they're just with themselves, like easing their possibilities of having this. The children might get very affected because they clearly don't like isolation for a long time. The same with teenagers, because most of their life depends on like public approval, like we know. And since they're like losing a lot of time of their school, and a coming of age milestones that can like progress them into adulthood, so these can lead to a lot of stress in them or like disbelief, I would say. Also, young adults who lose their jobs may also feel isolated, not just isolated but economically vulnerable, because as we know, all our countries depend a lot on economy, and especially that's how all the families work. So if the young adults are the only earning member, and if they lose their jobs, that's another level of stress and anxiety that they can have. Also, older people who lose their jobs may also feel a loss of identity or purpose, thus leading to feeling depressed. So my take totally as a conclusion on this would be, this pandemic can lead to two things. The first being the people who are already vulnerable. I can call it old age. I can call it people who are already depressed, have anxiety and stress. It can worsen their situation because of isolation, because of something that they do not like to do. That is just spend time with themselves, and they do it out of no option. But right now they have been forced to do so. So I feel that can worsen their condition. The second thing is the people who are fine and do not have mental health disorders, they can contact this, because these are the people who like going out. These are the people who, could do anything for it, and now they have been stopped from doing it. So just like concluding it in easier words, these are the two sides that I can see. Thank you.
I definitely agree with you, Ritika, here. The pandemic has taken a huge toll on people's mental health, which has resulted in a pandemic of its own and has disastrous consequences as well as an impact that is bound to stay even after the coronavirus has been eradicated or cured. And I think it's going to stay with us for a while. My next question from you, Mr. Hassan, according to your expertise, would be since you have been working in this organization, could you tell us about how individuals should look after their own mental health during pandemics such as this one?
Yes, I guess I'll give a few recommendations on that. So people can start by practicing positive coping mechanisms to help their mental health. More of us will be spending a lot of time at home, and maybe for our regular social routines might be disturbed. It will mean a different rhythm of life, a chance to be in touch with other different ways than usual. Be in touch with other people regularly on social media or email or phone. There are still good ways that we can keep in touch with each other, especially for those people who matter to us, our family members, grandparents, and friends. My personal favorite will be phone because that has a personal touch to it and just gives our family members and friends the comfort they really need at this point. You can start by creating a daily routine and prioritizing things and looking and taking care of yourself, such as my restful mind catered to its student needs, created a self-care kit that students can personalize to their own interests, such as music, reading, and watching movies. I would also suggest everyone to create their own exercise routine, since our interaction with nature and like other exercising routines might have become to a halt. So it's really important that we do that at home, and one way to do that could be through meditation. It can easily be practiced at the comfort of your own home. Make sure your wider health needs are being looked after, such as having your medications in hand. Try to avoid speculations and look up to reputable sources about the outbreak. Rumor and speculations can fuel anxiety, and good quality information can give you more stability and hope about the improving situation. So I would really recommend on going to sources that are reputable and credible. Try to stay connected within your family, friends, and colleagues, as they all need your support at this point. We are able to connect with each other in the changing times with different pace depending on who you are and where you live. It really is important that you use resources around you and connect with people. Advice is significantly different for people who are vulnerable groups such as children, pregnant women, and people above the age of 70. Stay in touch with friends on social media, but do not try to sensationalize things. If you are sharing content, use this from trusted sources. And if something is bothering you or some content is repetitive, do not share it with friends because, again, your friends can get stressed from that and might be worried more. Also, remember to regularly assess your social media activity, as overconsumption of information is dangerous towards your mental health and the access towards negative thoughts can also trigger a lot of mental health disorders. Talking to children, involving your family and children is really important within your decision making of the daily routines or your personal family self-care kit, to inform them about the situation, ask children what they have heard about the outbreak, and support them without causing them to alarm. Try to anticipate distress. It's okay to feel vulnerable and overwhelmed as we read news about the outbreak, especially if you have experienced trauma or mental health problems in the past, as all underlying mental health problems can be triggered just by a basic panic attack. If you have long term physical health conditions or are in one of the vulnerable groups mentioned, such as children's, old age, or pregnant women, then it's really important that you take care of yourself even more. And it's really important that the family and your friends shall stay connected with you so that they know about your health and can help you in every possible way. It's important to acknowledge these feelings and remind each other to look after our physical and mental well being. We should also be aware and avoid development of habits that may be detrimental to our well-being, such as smoking, drinking, or overeating. And in the case that you feel that you are developing such habits, it's really important to connect yourself with a healthcare professional or a mental health care or a mental health professional slash therapist. It's really important that you connect with a therapist who can give you professional advice. In times where you cannot access in-person therapy, is you can always go to online therapy platforms such as My Restful Mind and talk to a licensed therapist to address your concerns.
Ritika, please enlighten us on some positive coping mechanisms that you think people should adapt in order to take care of their mental health during outbreaks of diseases.
Okay, thank you for your question. So, basically, I see this pandemic as a place or as a situation where the only coping mechanism is you and your thoughts, and no one else can help you other than yourself. Because, like every time we have a solution that, oh, I'm not feeling fine, so let's go to the hospital. No, that cannot happen this time, because the more you go out, the more you go to the hospital, you're increasing the chances of contracting this virus. So it's really important for you to take care of yourself. It is very important for you to know what to do if you're sick and are concerned about COVID 19. You can't just go around asking for your test to be done, because we have a lot of population and we have like limited tests. So it's not possible for everyone to get tested. So I would say that first of all, it's very important for you to know what are the signs and symptoms, for you to not freak out just because you got a fever. There are a lot of things that differentiate it from a normal viral. So it's very important for you to know that what are the signs, what are the symptoms. Then you can contact a health professional before you start any self treatment for COVID 19. Before you just call yourself COVID positive, it's very important to get tested. It is very important for you to not go outside, and you could just call your family doctor, or you could just call some helpline numbers that are available right now, provided by the government, in order to like ease your tension, or in order to confirm your symptoms, or in order to ask whether you need to get yourself tested or not. Also, you need to take care of your emotional health, because in the end your emotional health is very important, because right now is the time where you can't find escapes from this. You can't escape to work, you can't escape to like not paying attention to it, because you're spending most of the time with yourself. And since I think that many people are spending time with their family also, it's very important that you do take care of your mental health, because most of us won't get this time again, spending so much time with our family. So why not use it to our benefit? You should take care of your body. You should take deep breaths, stretch, meditate, eat healthy, eat balanced meals, exercise regularly, get plenty of sleep, and also avoid alcohol and drugs. You should take some time to unwind. You should take some time to spend with your family. Maybe you could cook something together, maybe you could play some board games, maybe you all can watch movies together. It's very important for you to connect, because over here you are not meeting people, you are isolated from people. So you need to connect with them. If you're staying with your family, connect with your family. If you're not staying with them, we have amazing online platforms like Zoom, Google Meets, WhatsApp calls. So it's time to explore all these things and connect as much as you can. There are also like a lot of online sessions going on. If you like dancing, if you like singing, there are a lot of like artworks going on online. So why not take up some of your hobbies and like spend some time with that. Also, if you are someone who's very compulsive or like obsessive with the news about COVID-19, you need to take a break from that. You need to take a break from watching, reading, or listening to news stories, including those that are there on social media, because all of this could be a little upsetting. Because if all the day I'm just thinking about COVID 19, just reading about it, it's not going to help me. It's just going to make my condition worse. So it's really important for you to disconnect with those news and connect with your community. By disconnect with those news, I don't mean that just stop watching news and stuff. I mean that do not pay attention to everything that's been circulated about COVID-19, because there are a lot of rumors that are going on WhatsApp and on news channels, which we need to avoid. And we could instead like use authorized sources that our governments have provided, in order to know the number of cases, the number of recovery cases, etc. So in the end, if like everything goes fine, it's great for us. But if you think that you are positive and all the signs and symptoms suggest so, and I would say get yourself tested, and always like rely on your healthcare provider, because he's working for this. And last but not the least, please don't associate stigma with this, because I agree that it is very communicable right now, but it's not the end of the world. It's not, the death rates are not as high as we could call it. So just take care of yourself and maintain social distancing and stay safe.
Okay, that was very enlightening. from both of our speakers, Mr. Hassan and Ritika. And I would like here to give my own input that I have experienced, and I would like to share my 2 cents on this. That there is a thing that we practice because I have been working on a program on mental health. And when we were making the proposal, we came along this thing that was called mental health hygiene. If you practice that, that is very beneficial. So these are small things that you can incorporate in your routine. And if you could do that, it would really help you out. There are some things that you have to remind yourself every day. And in this pandemic, I think with all the workload that we have been doing, and especially as medical students and all kind of students, and the trauma that we have been going through, all the other things that we have to manage side by side, I think these steps could help you out. So there are some notes that you could write in a book. You could remind when you go to sleep at night. You could say back these to yourself every day. Like when you watch the sunrise, you just have to believe that you can come out of whatever dark phase you are in right now. There is another point. Tell yourself always that you are enough and you are worthy. Also, you don't have to say yes to everyone. Your body matters. Treat it gently. When you stand in front of the mirror, tell yourself you don't have to fit in any definition. Healing is not soft. Admit that and put effort into it. You will grow, you will bloom. And the very important, the not the very least, you just have to get through this day by being average. Inhale, exhale, breathe, just exist. That's from my side. So, thank you so much, Mr. Hassan and Ritika, for giving us valuable insight on how the pandemic has affected mental health of individuals around the world, as well as steps we could take to cope. We can now dive into our next topic for today, that is emergencies, disasters, and humanitarian action. What do you think, Alam Saif? More than half of the world's democracies have declared a state of emergency in response to the coronavirus. Are the emergency powers used in a way that is lawful, necessary, and proportionate? And are they time bound and covered by legislative or judicial oversight? What are your 2 cents on that?
So both the knowns and the unknowns of the coronavirus have led the national governments to adopt these extraordinary measures to counter the threat of the infection. Now, we have programs already in place. Like I had mentioned in the first webinar, there's a lot of programs in place from different structures in the US, for example, like FEMA, the Federal Emergency Management Agency that I mentioned earlier. They deal with all the major crises typically, right? It's an emergency management agency. So, excuse me, from terrorist attacks, natural disasters, economic turmoil, or biological threats, we typically turn to the government agencies to handle these issues. But we can look at the US's response and Canada's response, for example, as kind of a disparity to see how a government can give a right response, which we can say Canada did, and how government can give a wrong response, which we can say the United States did, which is pretty clear to see from the numbers of the people that are dying, right? Rest in peace to everyone who's passed away. 140,000 people. It's no small number, even for a nation that has 330 million people. So we clearly cannot rely so much on the government to take care of us. That's why they're pushing social measurements for people to adopt themselves, right? So, for example, me and Maham and Arslan and everyone that we know, we would want to wear masks. We would remind each other to wear masks. We would want to keep a 6-foot distance from each other. Basic things that we can do as people that either the government is having difficulty enforcing or the people are simply not listening to, whether it's ignorance, fear, or misinformation, which is common in the United States nowadays. Thank you, Trump, for that, current, way that the country is going. But, what can we do? So in the past few months, we've witnessed a lot of extraordinary measures adopted by many different governments. Nobody's ever seen a lockdown in and of itself, besides in a small area for, constrained or, for a small type of response situation. If something happens, like an attack happens somewhere, you lock down the city or you lock down a 15-mile radius. the whole world has been put in a cage, right? The Canada and US, like right now I'm in New Jersey. I used to be able to drive to Toronto in like, I think it was like 5.5 hours. And now I can't even go to Toronto because Canada's saying we don't want United States citizens. Like Hassan is chilling over there in Canada where everything is controlled. And like, I'm here too. Thankfully, New Jersey, New York area, we're very controlled. But Canada's never really shut their borders to us. It's very unusual. I can just go through a border with my driver's license, and now I can't even go in without having to quarantine myself there for 14 days, But at least 83 countries have imposed emergency policies with the UNHCR, UN High Commissioner for Human Rights, and only 40 countries have notified the UN of derogations from their human rights obligations, which essentially means that the WHO will give everyone their guidelines. It's a World Health Organization, right? The entire world goes off the basis of some of the things that they're saying in the research. We give them our trust because we have some of our own constituents in there. We have our own sayings and we have things we can add to it. But again, does everyone follow it? We can look at examples like Vietnam that have 0 deaths, right? We can look at Thailand, which has a very good grip on it. Canada, I'll mention again, has a good grip on it. Pakistan, which I was working on, the response team with, we're doing much better now too. Like, it might look like the situation isn't too great, but in the high population density areas, obviously there will be continued struggle to maintain control. But in your periphery areas, in your tribal areas, there's a slightly better grip on it just because there's a slightly bigger spread of people, right? So we can see Bolivia, France, Morocco, they've imposed health emergencies without formally notifying relevant treaty bodies of their actions, right? So essentially, one of the issues too is governments acting out of the scope of their ability. Now, we think the government is a monolithic structure for the country you're in, right? Like if I'm in America, the United States government is the end all for all decisions, right? But that's not the reality. It's a democratic government. It's a federation of the people, right? It's different from China. China's response was so great and so tightly locked down because it's a communist country. If I have 5 hospitals and coronavirus pandemic starts, the Chinese government would tell me we need 4 out of 5 of your hospitals, and like that's it. There's no, there's no, oh, I don't want to do it, right? That's not how things work. Okay, it would be a communist government takes the resources, they distribute it as needed. That's why the Chinese response is so different. It's a communist government. It's a different government structure, right? And a democratic government has a lot more liberties, you could say, that they give the people just based off of the Constitution, in the US Constitution, for example. You have more liberties that you have, and obviously you have your issues as well. But we can see that these are the type of things that are causing issues. Yes, absolutely, we need the freedom, we need the liberties, but the people need to be more understanding with the government, or they need to have more of an active hand and active voice in the government. Because we can see just from the 2016 elections of Trump that it was only 32 or 33% of the whole entire United States population that actually voted during the elections, which is why everyone, a lot of the people are upset because they actually didn't vote or they didn't get the chance to vote. Now, in Israel, there is an attempt to effectively suspend the Knesset, which drew criticism as an abuse of power. Not much of a comment there. Israel has, many issues with their government policies, just like any other government. But, Palestine has been consistently neglected as well. It's a very population-dense place, and it's a whole complicated amalgam of issues there. But in Thailand and Bolivia, new emergency laws and decrees allow broad censorship, undermining free speech. Things are slowly, as we're putting things together and there's less cases, we see that while we weren't paying attention, while everyone was having this panic and anxiety, things were being slipped under the carpet or under the door, let's say. There's also Uganda, for example. Let's go to the African continent, where women were forced to undress during an incident of police abuse, and South Africa, where children were injured as a man was shot in front of his home. And authorities have promised to prosecute and punish the officers responsible, but it's a crazy situation. We need to, ourselves as constituents of whatever government you're from, we need to stay alert, aware. We need to hold the government bodies accountable and make sure human rights are actually followed, looked after, and maintained.
Hey Maha, during the pandemic, the threat of natural disaster still looms. The thought of facing both at once worries some who would be in charge. How is the coronavirus complicating disaster response? What are your thoughts on these?
Thank you, ma'am, for the question. So I'll start with the statement that says that disasters won't and would never stop for a virus because disasters are unpredictable and the world is prone to disaster. So it can happen at any time with anyone in any country. It doesn't come with an invitation. With the pandemic going on, all the countries have an emphasis on the coronavirus situation. The wards are particularly the kind of set to coronavirus patients, and the most of the importance given by the countries, the stakeholders, or any other working environment is to coronavirus. But what if a disaster hits in such strict conditions? That would be a massive, I don't know what kind of a word should I use, a massive disaster or a massive dilemma in the situation, because we wouldn't be able to cater the needs. Because when there is a disaster, there's a lot of things that are required. For example, we need the resources, we need the government involvement. But disasters don't stop and would certainly not stop for a virus, because no matter what the situation is, the world is prone to disasters, and disasters can come up without any invitation in any part of the world. So if something like this happens, because we need resources for the disaster, there's always preparedness, responsiveness, and all the loop that covers the disastrous part. If disaster happen in a situation where there is a pandemic, there is a massive risk for casualties, because let's say that with the disastrous conditions, no one is going to follow the steps for like the prevention of coronavirus. And what if they get affected from the virus, and who would be responsible for that? So there's a lot of technical stuff, and there's a lot of precautionary measures that comes up in such situations. But I would like to state another example, that with whenever there is like whatever, no matter how much rushy the area is, there is always one line that is open to the emergency, for example the rescue staff or whatever, ambulances. So I would say that every country should have this in their systems or in their laws, that they have the backup, they have the security check. For example, no matter whatever pandemic situations, riots, wars, whatever is going on, they have the back end for if or for a disaster strikes, they are safe for it, and they're prepared for it. So I would just emphasize on the word preparedness. We have to take in consideration all sort of things that could come up in the particular situation. We have to get ourselves prepared for the worst, that I would say, because considering the current situations, all of the faculties, all of the hospitals, their major priority is coronavirus. Even the wards are isolated for the virus, and the other patients are not being taken, I would say, that not being given the same importance as the coronavirus patients. So I'd say that the emergency department should stay for emergencies solely. It wouldn't, like we should have a safe side no matter what the conditions are. I hope that answers your question.
What's your take on this, Alamzai? How has the pandemic impacted natural disasters?
So, coronavirus is a complex global crisis. We've never seen something like this. The world isn't going to wait for humans to get out of their issues to continue moving on. It's going to continue revolving. The moon is going to continue going around the sun. Sorry, the moon is going to continue going around the earth. The sun is going to continue, doing its rotations in its turn. We're not the only creatures here, but all of our technology and our competency and our capabilities should be able to help us now. We think it would be able to, but clearly it's not. All of our, or not all of our, but most of our resources are being taken up by the coronavirus response. All of our microbiologists, virologists, healthcare teams, we're focused pretty much solely on coronavirus. And we almost are forgetting that there's still typhoons. Pakistan will still have their locust issue, which was popping up right around when coronavirus started. And the locusts, I'm sure, are still an issue, although unfortunately they're still continuing in their trend of going from west to east. So India will be, is getting affected by the locust now, unfortunately, and they will be, just like Pakistan, will probably be having a hard time dealing with the issue because the pandemic is ongoing. Now, how would people and systems cope if a major natural hazard like an earthquake or a tropical cyclone occurs while the pandemic is going on? We don't know yet. We're going to see. I can give you a local example. When I'm in New Jersey, we just had a tropical storm recently, and a neighborhood in central Jersey, New Jersey, lost their electricity, 7,500 people for a little while. That's very unusual, by the way, in the US. That's not a normal thing to have load shedding or electricity issues. We have pretty great grids, and it rarely ever happens. So there's also something else unique that we can see that's on its way, which is there's a dust storm coming from the Saharan desert in Africa, and it's going westward towards the United States, and we're going to see what's going to happen, right? The last time there was a dust wave, it almost crippled the United States. That was back in the Great Depression era, a little bit before that. Actually, it's called the Dust Bowl, where many farms were just swept away. People's livelihoods were destroyed because all of this dust was just pouring around the country, and nobody could get their work done. So our new research combines simple epidemiological models with natural hazard curves. So if kind of like you would look at a business or like, some way to make money, because that's how people look at things, right? That's always been the most important thing. We're starting to reprioritize now, right? Like a value chain analysis curves, right? We're looking at natural hazard curves. But again, how accurate can we be? We were barely accurate in dealing with a viral pandemic, which we knew was a reality and was going to come. And natural disasters are fairly muchly so almost unpredictable. For earthquakes, for example, we have our seismic detectors, but even then, you can have your detection and then maybe you'll start to evacuate a city, but then you have you have a massive scale earthquake that can take out half of a city in the most unfortunate of circumstances. So importantly, if we're able to actually outline these models and these hazard curves, perhaps we can do better in mitigating the crises. But, like the Australia bushfire and like this dust issue that I'm talking about, cyclones, hurricanes, we have to be kind of forward thinking in it that we have a pandemic. Yes, we're going to try to maintain that within its own parameters and in its own lane. But now we're going to have natural disasters, and we'll still need resource teams for that. We'll need our firefighters, we'll need our paramedics, our EMTs, we'll need our doctors to be dealing with the fallout of it all, right? So if we can come up with a plan, then yes, we can absolutely deal with it. But if we can go against the natural disasters in a proper manner using all these researches that we've been doing, maybe. But I'm not going to lie to you, I'm not too positive about it. I'm not too optimistic, because just from looking at the pandemic response and the fairly high levels of incompetency and misinformation and lack of coordination, let's see. We can only hope for the best.
Maha, what strategies do you think governments can adopt to counter the compound risk of COVID-19 and natural hazards?
Thank you, Maham, again for a wonderful question. I would like to say that in the absence of the vaccine, projections of coronavirus transmission indicate that the current crisis will be protracted one. It can go on long and long because there is no vaccine again. But there are 4 preemptive strategies that governments can adopt to counter the compound risk of corona and natural hazards. Starting from the first one that says identifying possible pandemic, natural disaster, hybrid scenarios, including the worst case scenarios that are critical. This requires the building of new hybrid forecast models that combine existing pandemic projections and the models, then is the natural hazard forecasting all together under one branch. Secondly, emergency responses to extreme events can be modified in advance by considering seasonal weather forecasting models that I think already exist in all of the countries. There are already predictions of how an above average Atlantic hurricane season this year. So it's likely that a major hurricane would make landfall in North America in the next few months. Planning ahead is a key. That is where the preparedness comes from, because we always plan ahead of what is coming, and we have all this technology, so why not make use of it in a wonderful way? Thirdly, redesign of a policy response is needed to address different natural hazards with a focus on social distancing. Policy changes must be introduced to a wide range of post-disaster activities, ranging from emergency aid distribution to even providing shelter. And finally, supporting the relief agencies serving lower-income communities or regions as their government basically is important as impact of compound effects and on areas are likely to be disproportionately high. So what I think is that whatever is the planning, there comes a preparedness part. And when you are prepared enough, when you have learned from the previous disasters, because we think as students, we always talk about feedback, having the previous feedback, so we can always do better in the next thing. So I think that if we learn from what came before and work on how we can efficiently, prepare for the next one, that would be always beneficial. Paperwork and all that thing would stay there, but you need a prompt action at the site of the disaster where you can work efficiently, considering the resources you have. So a mind map or a map allocating the resources near that area or near any area where it is thrown would be very efficient, I think.
Thank you so much, Maha. That was a wonderful insight. Alam Saib, in your opinion, how should government tackle the dual risk of pandemics and natural disasters?
Hey, thanks for the question and great answer, Maha, as usual. So planning for natural disasters should mesh with a pandemic response, like Maha was saying. Just from what I know and from what I've had been trained in and learned, my standard response system would be going off of, I'm going to mention FEMA again. That's like kind of a lot of my framework ideas and what I know. We have an incident command system, right? We have a national incident management system. We have those systems ready where we can actually deal with a pandemic and a natural disasters and all technicalities just with what we have already. We have a RTSP, it's called, for an online resource typing system. And that shows all the resources in every state, in every county, down to your very small, minuscule level, if the people in each sector are trained properly. It also has to do with the competency of the people in the system. If you don't understand how to do your job, or you have a 50% or 75% understanding, then how will you be able to adapt very quickly if you don't understand it and come up with new policies and be able to adapt to the new SOPs and SOGs that are being pushed upon you? We should be able to already respond to a hurricane while a pandemic is ongoing. It's as simple as you're shifting and allocating the resources to exactly where they need to be. That's the whole entire purpose of the system. If I have 100%, I have 100% of my resources, this area now, New Jersey and New York, for example, are on a decline of cases. We don't really need as much of our resources. We don't, in case there's a second outbreak, yes, you would need them. But, you can shift the resources to a hurricane area. Like when Hurricane Katrina happened, for some reason, not for some reason actually, it's that the specificity of the government response wasn't sufficient. So a lot of people died. The evacuation response, the holding of people, the entire situation was a mess. And, if you might recall that George W. Bush, the president, had just flown over the area of Hurricane Katrina after the response and didn't even go down to visit it. So it also has to do with your overarching branches of government. Is there competency there? It's not about how should the governments handle it. It's that, can they handle it? They have the abilities. I have a fork and a spoon to eat my dinner, but I don't know how to use the fork and the spoon to eat my dinner. You get me? So if we don't know how to utilize the tools we already have, we cannot make new tools to deal with the issues that we have, right? So if the government focuses on competency, accountability, cutting out the latency, cutting out, I'll put it bluntly, cutting out the stupidity. We don't have time for nonsense. We see it now. Hundreds of thousands of deaths are unacceptable. 10,000 deaths is unacceptable when you can control it. So again, I think I'll go with not how should the government handle it, or how can they tackle it? Can they tackle it? Because they can. But how they should do it is already outlined for them. Like when I was in SWAT, I had, me and the district team, we were working on a response system, right? When I went to Islamabad and I visited the National Center for Health Coordination and Management, they were already coming up with a new system as well, but they were only 80% done after 3.5, 4 months in. So I had come up with my own system in 3 months, right? And it takes an entire government office that same amount of time to be 80% done, right? So I'm not saying, by the way, that the office is incompetent. They're great guys. They work really well. But again, can we do it? Cut out the parts that are cancerous. Cut out the parts that are just taking energy and resources away. Make it as efficient as possible, and you'll be able to deal with anything.
Thank you so much, Alam, for the wonderful answer. I really appreciate such a wise answer from you. Just a bit of thing that I would like to add over here. You said that thousands of deaths are unacceptable. Even one death is unacceptable because the responsibility lies on the shoulders of the governments again. And the greatest of the strikes or greatest of the reforms in the world started from one death that was unjustified. So if that's not justified, that's on the shoulders of the government that I think should need to take the precautionary measures or the right preparedness to work for the sake of their nations or for the sake of their people. Thank you.
That was beautifully summed up by both of you, Maha and Alam. I love how Maha always comes up with the most apt, also wonderful answers that sums up the conversation. And Alam is always up with technicalities, part with examples. Maha, what's your take on the opinion of investing in humanitarian relief now to limit possible catastrophic impact of coronavirus?
Thank you, Mom, for your question. And I like your authoritative tone when you ask Maha how you would like it. So I would like to start with my answer with the fact that how many people among us know about humanitarian relief? The other day, I was asking a friend about a post that he shared on the UN Relief Fund. So it's not that there are a lot of funds that are there for the help of the needy, for the help of the refugees, for the help of the poor people, for women, for children, that the one that are deserving. But if I talk to you about, I don't know if I have to talk about in international regard or in the national regard rather. But I would say that there are a lot of funds over there. But what if your people are not knowing about that? What if your population, more than half of, let's say, if the quarter out of your full population is just literate, and what about the rest of the half that is not literate enough to know about it, to seek for it, to ask for it even? Well, how about that? Who would tell them that there is something like that? Who would hold the people, the government officials accountable that they are responsible for the funding of these people? So these things like this go deep down to the scratch, where I am talking about the literacy of the people that they're not even aware. Let's not begin with the government who's responsible for the needs, the basic needs according to the Declaration of Human Rights. That the government is responsible for giving the humans of the country the basic needs that they strive for. There are certain organization, let's say about UN, that jumps into such conditions, and then they develop a fund for some countries that are underdeveloped and that cannot even have funds for that. What if in such situations, who's responsible to take that fund to the people over there? But what happens in the times of the corrupt government? I'm sorry, I'm taking very rude facts into this conversation, but this is the truth that is there. Now let's say that this is a COVID and there is a lot of situation, there is a lot of things like all the countries aren't stable and all the people are not the rightest people. I believe that if there is half right, there is half wrong too. And what if we are under the half wrong people? What if there are coronavirus refunds that are available and they're not reaching to the patients? Such situation in the country, there is a lot of what you say, the fancy word recession. The country enters into that recession, and you know why? Because in the coronavirus situation, there was a lot of lockdowns, and because of lockdown, there was no jobs, there was no active business and anything's import export like that. So it was not even in the country of Pakistan, it was everywhere. But why I would say it impacted the developing countries? Because most of our nation are daily wages, and because of the daily wages wouldn't go out to earn their daily wage, what happened? They are suffering with poverty because most of the people weren't even the ones who would save for one day. So most of the people weren't the ones who would go out for one day and save up for their next day. They were just earning for their daily purposes, and that they could feed on daily purposes to the people, to the family, who they're like maybe sole bread owner of. What happened in such conditions? Like there are a lot of newses in our national TV channels in which people committed suicide. Not only them, they committed suicide with all their family along with their wives. Why? Because they couldn't foresee any safe future, neither from the governments, neither for the stakeholders out there, or for the organizations that so-called tell them that they are there for any sort of help. Because of course they wouldn't know about it. There are no resources available. Lately, there was 75th anniversary this year of United Nations, and over the 3 years, Humanitarian Affairs segment tackled a host of emerging and pressing humanitarian issues as the United Nations marked this anniversary, of course. And what came up that 90 billion to safeguard world's most vulnerable were given or were decided, warning that the pandemic has the potential to catastrophic in the developing world, and the cost of protecting more vulnerable 10% of the people in the world's poorest countries is 90 billion. Now, stating that 90 billion is our budgets, like allocating to that part only, do we allocate some part of our chunk of our budget to that area, in which we regard the poor people who wouldn't even go out on the wages? I do truly respect, like, of course I am from Pakistan, and I will give you an example of what I actively go through. The Pakistani government, they recently they allocated some fund for the poorly, but what was my concern was, did it reach the poor people? Was there a survey before? Was there anything that made sure that it reached all the population there, even on the farthest end or the peripheries of Pakistan, even in the rural areas, up and down? Because we are responsible for everyone out there. If we talk about as a nation, we're a very generous nation. Someone comes up to us, they talk about their issues, we wouldn't think twice. I would proudly say that we wouldn't think twice before helping that person with the issues. But do we need policies? Shall we have done this before? Because of course, like, in a country like Pakistan, what goes smooth, but what if it was done before, prior to coronavirus? What was it was done, and it was more handy for us to implement it now, because we had proper surveys, we had proper list of people. We wouldn't waste all this time for the people to go out and suicide. Rather, we would be just helping them and going to their places. Another story that I would share, I'm sorry I'm taking most of your time, but this part is very close to my heart. We were doing a really fun, and we were going to the rural areas, home to home, and giving the, what we say in our language is ration packs, that has all the necessary items, the grocery items for a month. We entered the home, and the lady happily welcomed us. That is our humble culture. We went there, and the lady was she was a very old lady. I would believe that in her late 90s. And she said, welcome, and what is happening outside? So we try to explain her the situation, what's happening outside. She said, I don't know if I should pray that corona should last for long, or I don't know if I should pray it should end soon, because this in the years is the time in my house it feels like Eid, which is a real religious event over here, because we have a lot of food. We never saw this much food in our entire lives. So that struck hard to me, that that lady wouldn't even afford the basic necessities, even once or twice, 2 meals per day. So are we, what is the government answerable for? So that what, like, I would end my statement, or what you say, a long talk on this topic, that we need preparedness again. The government should be involved in the surveys, in the documentation, because at least we should have something in hand if something uncertain like this comes up. Like, because this is a flood season in Pakistan, there would be a lot of landsliding, and there would be floods, and there would be a lot of issues. There would be a lot of people that would be taken off from their homes because of the natural situations. So what is the government prepared? That is my question. Because if the government learned from what happened last year, they would have been prepared, and they would have absorbed it at the right moment. So yeah, that would answer, I hope that answers your question.
Maha, that was a very warm response from your side. And no, I was not authoritative at all. That was because of the severity of the question. I loved your response. And as you said, that it was very close to your heart, and we could feel it in the way you were talking about it. I completely agree to your points, and especially to the policies that you mentioned. Also, I would like to give her my input that yes, how would I feel about things like these if it was happening to someone in your shoes, and like happening, the same thing happening to them? I would now like to ask the speakers to sum up and give their parting statements before we end today's episode. Let's begin with Ritika.
Mental health has been hidden behind a curtain of stigma and discrimination for too long. It's time to bring it out into the open. For all individuals, mental, physical, and social health are vital and interwoven strands of life. As our understanding of this relationship grows, it becomes even more apparent that mental health is crucial to the overall well being of individuals, societies, and countries. Thus, I encourage all of y'all to take care of your mental health during the pandemic or not during the pandemic, especially right now, and so that you can spend the best time with yourselves. Thank you so much for having me here. I think this is a really thoughtful activity and also the first time I've ever been on something like this. And I am super excited and really thanks a lot. And I hope it's a success. Thank you.
Thank you, Ritika. Mr. Hassan?
I would like to sum up by actually enforcing that we have an individual responsibility as global citizens to, first of all, take care of ourselves, our own physical and mental well being. Secondly, take care of the family members and friends around us. And that really means that we should maintain social distancing and not really have physical contact with them, but still stay in touch with them over social media or email. It's really important that we take care of ourselves by involving ourselves in productive activities rather than developing detrimental habits that could damage our own physical well-being and impact the society in long term. In terms of emergencies, I would really say that this is a difficult time for all of us. All of us are in a lockdown and we don't have the same liberty to actually move around or the freedom to move around that we used to. But we will get that back eventually if we maintain if we maintain with ourselves within the boundaries of the civil laws defined in our respective countries, we'll definitely things are turning better and we'll get out of that situation very, very soon. We do have to wear masks. I know there is a lot of people have complained they have mask anxiety, and that does cause that. But we also need to realize that the merits of wearing a mask outweigh the demerits of not wearing a mask. So it's really important that we do consider those precautions and the SOPs identified by the World Health Organizations and our own local governments. Finally, I want to mention about disasters. Generally, floods or earthquakes or does create a huge impact on COVID situation, especially when we've seen that the unemployment rate has gone high enough that people have been or have had food since weeks and days and they need our support. So, in terms of people who are suffering from those disasters, such as recently we saw floods in Bangladesh, so it's really important that we take care of those citizens that are going through that turmoil and we give our support to them financially, but do give our support through proper channels and still maintaining that social anxiety and the SOPs defined by the government. Thank you.
Thank you, Mr. Hassan. Maha, how about you?
So it was really wonderful to be a part of this podcast, learning from an expert CEO about the mental health, because of course, mental health is an issue everywhere. And no, I won't say that no one suffers from it because everyone at any point of life would suffer for it. And so is a disaster and humanitarian response, because the world is, again, as I said before, is prone to disasters. And you don't know that where it comes from. It can come in any stable country or in any unstable country. So I would emphasize on the word again of preparedness, that be prepared for that. If you're a student in your capacity, be prepared for it. Write on the policy documents, because this is in your capacity. You could do advocate for it and strive for the cause you believe in. Thank you so much for having me.
Thank you, Maha. And last but not the least, Alamzeeb.
Thank you for having me on again, Arsalan from AIMC, the coordinator, Maham, who was moderating the whole entire thing. I learned quite a bit as usual. I like to read and research, and I'll just go back on some of my previous statements in the podcast where it comes down to competency. It'll always be competency. We'll always have so many things there for us to use, but me and you and everybody should keep an eye on the systems. Are the components correct? And can those components run it correctly? So that's all I have to say. And stay smart, stay safe, keep your distance, wear your masks, live life. And like Mr. Hassan from Canada has a focus on the mental health, keep an eye on your mental health as well. Use his application if you need to. That's what it's there for. He's there to help people, and let us doctors and healthcare workers work on the healthcare side, and we'll do our best for you and you do our best for us. Thank you.
Thank you, Alamzeeb. Well, that wraps up today's episode. Thank you so much, Mr. Hassan, Ritika, Maha, and Alamzeeb for taking time out and joining us for this episode. To all the listeners, we hope you had an amazing experience tuning in today. Thanks for listening to the Score Podcast. Stay tuned for our next exciting episode coming up real soon. Until then, stay home, stay safe. Don't forget to like and share this episode and subscribe to the channel for all the updates.